And joining me live from Tel Aviv, Dr. Noya Shilo is the head of the Returned Hostages Clinic at Sheba Medical Center. Thank you so much for being here with us.
Thank you.
When the Hostages and Missing Families Forum came out talking about all the problems that are being experienced by the former hostages, both physical and psychological, I mean, you mustn't have been surprised. I mean, you've been facing such unique circumstances treating them that you said your hospital, quote, had to reinvent medicine. Explain why.
In many ways, I think that the atrocities of October 7th and the aftermath of people being the civilians, children, elderly, women and men being taken hostage from their own homes, from their own beds, and being taken hostage in the most violent, cruel ways one can imagine is something that we've never faced before. And the aftermath of that really calls for a new kind of medicine, which is exactly what we're trying to invent for them.
So before we get to exactly what that is, I just want to know what are some of the most common and persistent challenges that you've seen in these patients now a year after their release?
Okay, so there are a few types of things that we handle. First of all, there are injuries from the kidnap itself. Usually, most of them are gunshot injuries that were very badly dealt in Gaza, obviously, and we're dealing with that. There are chronic diseases that were neglected, and we're dealing with the consequences of them being deteriorated. And the third thing is the damage, the physical and emotional damage of being taken hostage and being in Gaza. And this is an ongoing challenge for them and for us to help them go through it.
The report mentions the difficulties of reintegrating into daily life, including going back to work, education, things like that. I mean, one can just imagine intuitively it wouldn't be easy, but take us through some of the issues that they face.
I think the main thing is that we cannot talk about healing or rehabilitation as long as we're not post the trauma. The trauma is ongoing. Some of my patients have family members who are still kidnapped in Gaza, which is unacceptable, unbelievable, and it does not allow them to go on with their lives as long as the war is ongoing and as long as there are hostages in Gaza. It's impossible to move on.
So what are you learning then in terms of trying to help them to integrate their care together, and what success stories have you seen?
Well, first of all, I want to say that I will not mention any personal stories because these are not my stories to tell. Obviously, it's theirs. But I think that's what's really moving, in my opinion, is to see the incredible resilience and the incredible power of the community, of the people themselves, of their families, and of us being with them, trying to help them in any way we can. And I think that once they see, there's the magnitude of miracle in the fact that they came back home. And what we're trying to do is help them go from post-traumatic stress disorder or the trauma itself to post-traumatic growth. And this is actually one of the biggest goals of our work, is to help them grow beyond the trauma. It's a very big challenge. It's very individual. Each patient has their own path, their own challenges, but this is our goal and this is what we aim for.
Yeah, a huge challenge, as you say. Still some 100 hostages left in Gaza. The report
Yes.
emphasizes the lack of a dedicated rehab path for former hostages. So one can hope that these 100 will come back to Israel. In that case, what recommendations would you make to the Israeli government that would improve the current system to support these people who come back?
I think the main thing beyond anything else is bringing them home now. I think it's the obligation of the Israeli administration, and we need all the help we can get, both from the American administration, the Biden administration, the President-elect Trump administration, and everyone around the world to help us bring them back home. Once they're here, we'll take it from there. but we need them home now.
All right. Well, we certainly hope you get your wish. Dr. Noya Shilo in Tel Aviv, thank you so much.
Thank you.